I'm Honorable Alinur Derrow, member representing Wargadud ward. It so happened that I became a COVID-19 victim. I happened to go to a private hospital after attaining high temperature, high fever, and cough, and immediately they took me to an X-ray and they examined me. They alerted the response team, Mandera Referral Hospital. The response team came and in fact they carried out samples of COVID-19 test, and I happened to be positive. Let me say, it is with the grace of God that Alhamdulillah today I'm talking and giving the real situation of my status. The response team has done marvelous. In fact, the coordination for the Mandera County Referral Hospital, what they have done and in terms of health service delivery, in terms of addressing COVID pandemic in Mandera County is wonders. It is with the grace of God that today I got free services in terms of addressing my COVID-19 situation. If it were in Nairobi, I could have paid over 10 million. The health team led by Dr. Eda, I say the foresight that you created here. Before, this center was supposed to be a rehabilitation center, but when you changed it to isolation center, in fact, it is with your foresight and the knowledge God has given you that you made ensure that such facilities are available.
My name is Dr. Mohamud Eda, the CECM Health Services Mandera County. Let me take this opportunity first to thank God, the Almighty, who has brought us this far in as far as fighting this COVID pandemic is concerned in Mandera County. As you are aware, Mandera is one of the first counties hit by COVID-19, and being a county that is resilient and having an attitude of never say die, we had mounted one of the best possible responses in terms of containing COVID-19. We had multi-layered response, which was led by His Excellency Governor Ali Roba, and the entire county government was in the forefront. Not only the health team, but the entire county government, because ours was a multifaceted, multi-layered approach in terms of response. To this date, we have had about 97 COVID patients who have passed through the county referral and the county COVID-19 response center, the isolation center. We are glad that majority of them, that is 92 of them, have recovered and gone home, including the last patient who was here and is being discharged today. We thank God for that, and we give immense appreciation to the health staff at all levels, but more so those who are working in the isolation centers under very difficult circumstances, but who have given all their efforts and all their energy. They have dedicated their time and energy to make sure that they see to it whoever comes to the isolation ward gets the best care. I want to reiterate that COVID-19 is still in the county and is still in the country of Kenya also. That means we should not lower our guard. We should keep observing the protocols, including masking at all times, hand washing and sanitizing where possible, observing social distancing, and making sure that if there is any symptoms of COVID, our people come to health facilities, because initially, while we were struggling with taking samples to Nairobi, we have had to partner with KEMRI, and we have set up a state-of-the-art molecular laboratory at the county referral hospital with a turnaround time of 4 hours for results to come out. All these services is free, courtesy of Mandera County government, led by His Excellency Governor Ali Roba. Finally, the country now is rolling out COVID-19 vaccine for frontline healthcare staff, as well as security and teaching staff. I want to reiterate that all healthcare workers should benefit and come for COVID-19 vaccination, as well as the security personnel and the teaching fraternity.